So fertility treatment, as we will talk a bit about them, there are a number of them. It's not only one. We have a number of them available. Some of them take a short time, others take long. Some can last as short as 2 weeks, others can last even 2 months. Sometimes it is even longer than that.
Even a year.
Even a year. So sometimes you have to fix some things first before you go to the final treatment.
You just first have to know the cause,
exactly.
I think, so that gives you the best.
Exactly. You should know what your situation is, what journey is going to be suitable for you, what you have embarked on.
Okay.
Yes.
Doctor, what if we have a couple that have tried all the treatment options for years now, but still they failed to get a baby? Is there any other option or hope for such a couple, really, if they've done all? I think they went for treatment for about 4 to 5 months. They kept on trying, praying, but still up to now, so far now, 7 years. Could there be any other possible solution?
Well, it's hard to tell what could be happening. As I told you, there are different treatment options available for infertility, which I think we may have to mention a bit. But broadly, the approach to fertility treatment, there are 2 approaches. It is based on the concept that if a couple is failing to conceive and then you have identified a problem, okay, you could opt, you have identified, for example, it's a tubal problem. They are not conceiving because of the tube problem, or they have an issue with the sperm. You could decide to correct that. Okay. So the approach could be correction. You want to put things back in order so that they can conceive normally. Another option is you say, okay, this obstacle you're having, I may not be able to correct it, so I can bypass it. So we have technology to bypass that. That's when the concept of IVF... You build another road. Yes, you build another road instead of...
Going straight to you.
Exactly. Okay. So this is again, of course, dependent on what the problem is. Okay. And as I mentioned earlier, there are some people for whom you can actually comfortably say that, you know what, you can hold on. You could conceive naturally on your own. Because fertility treatment is expensive. You want to really do it when it is necessary. True. Yes.
True. Yeah. True. Thank you so much, Doctor. Let's look at the treatment options. Do we have any illustrations so that we can say exactly what we could be treating?
Treatment options, I think we can look at the...
You start with women?
Yes, so the treatment options, we can look at briefly like this. The treatment options depend on, first of all, the cause, what is causing the fertility problem. One of the options which you should not forget is no treatment. No treatment is a treatment option. Because if you have done all the tests and you identified no problem, or the problem is such a minor problem, for example, maybe they are not meeting very well, they are not meeting frequently enough, or it's something to do with the stress, you can tell them that, you know, if you sort these things out, they get cancelled, give them some time. Most people in that category will be able to conceive within like 2-3 months. Okay. Yes. But in some people, you have to, of course, again, depending on the cause, if it's a problem of ovulation, there are certain conditions which affect ovulation. For example, PCOS, somebody is not having frequent ovulation, you get medications to help them ovulate, to release eggs. Okay. Yeah.
There's something
if we will look at that when we do at I think the IVF options. So it could be something to do with ovulation. You just have to induce the ovulation, the egg is released, and that's the problem sorted out. Okay. Or it could be a problem with the tube, and then if it's the problem with the tube, you could correct it with
you create another path, like you've said.
Yes, or you can use another path, that is you do IVF for it. Yes.
Okay, that is IVF.
And then sometimes we can do insemination. So we can look at those options in details, one by one.
Okay.
Yes.